So I'm going to talk about the diagnosis of agoraphobia and how occupational therapy can play a role in treatment. So agoraphobia is actually an anxiety disorder, and it is characterized by someone feeling an intense amount of anxiety and fear that is disproportionate to the situation or environment that they're in. So this can include several fears, such as the fear of being alone, fear of crowds, fear of leaving home, fear of public places, and feeling detached from others. So while not every single case of agoraphobia is seen in clients who have panic attacks, at least 30% of them do. It's not that common of a disorder otherwise, however, between 1.27 and 2.5% of United States citizens will develop this disorder with or without panic attacks at least once in their life. There are several other disorders that is comorbid with agoraphobia. The first one would be specific phobias of other kinds, that's 60%, and then borderline personality disorder, 51%, followed by separation anxiety disorder, major depressive disorder. So there are a couple of risk factors that are seen in clients who develop this disorder, such as early or recent experiences of loss, childhood separation or school anxiety, and a family history of anxiety orders is usually pretty predictive of someone who might develop this condition later. So there are a couple qualifications as outlined in the DSM-5 in order for a client to be diagnosed with agoraphobia. They must have marked persistent fear for at least 6 months of two of the following: using public transportation, being in open spaces such as a parking lot or a grocery store, being in an enclosed place such as a train or a shop or an elevator, standing in line or being in a crowd, or being alone just anywhere outside of the home. So there's some other factors that will be present in these clients. The same situations they're in that they have trouble with will always trigger that fear or anxiety. The patients will actively avoid the situation, or they will require a trusted companion or someone to come along with them in order to feel comfortable performing activities there. The fear or anxiety is out of proportion to the actual threat, which also is taking in account of their specific sociocultural norms. The fear, anxiety, and/or avoidance causes significant distress or significantly impairs their social or occupational performance. And they have thoughts that escaping the situation would be difficult or impossible, or that if they were trying to get away and they couldn't because of a panic attack or because they were too fearful, that there would be no one to come help them. So there's some symptoms that we can notice in someone who has this disorder, such as a sudden outburst of disproportionate rage or other intense emotions, extreme idolization and devaluation in relationships, fear of enclosed spaces, feeling a loss of control, trembling, and fear of leaving home alone. So there's some physical symptoms such as rapid heart rate, excessive sweating, trouble breathing, feeling shaky, numb, or tingling, chest pain or pressure, lightheadedness or dizziness, sudden flushing or chills, and upset stomach. So the OT can play a big role in a client's life. Some treatments include behavioral fear reduction and avoidance reduction procedures, using cognitive behavioral therapy, helping manage medications such as SSRIs, which will reduce their anxiety. And telehealth also plays a big role for some of these clients who are unable to leave their homes due to their disorder. Also, the OT can help find triggers and the source of fear or trauma that is causing this disorder and help the client rationalize and properly deal with them. Refocus attention on positive engagement in occupations, find ways to facilitate gradual integration into previously held occupations that are important to them. Give them some coping techniques and stress management, such as positive reinforcing affirmations that they can repeat to themselves silently or quietly in their head when they're in these situations, and making outings or activities increasing in difficulty with a trusted companion or a therapist to gain confidence.